Dr. Nadeem Hassan, for being here. You're only my third guest on WTF is Life, a podcast slash show slash brand that I am trying to cultivate in service of meaning and authenticity and fulfillment in the world of psychology and philosophy. So today, speaking to short-term therapy in the context based on where you work, not only your training, your modalities, etc., trying to amalgamate all of that or hybridize all that in a way that essentially keeps it effective, keeps people happy. I don't mean that clinically as much as I mean to the bureaucracy, and has obviously affected your training, what you provide, or your treatment. So as we get started today, if you could introduce yourself and provide a little bit of background. I understand you're at San Jose State University, what it's like to work, presumably with college kids, knowing that there's a time limit, which is a whole different approach to this type of psychotherapy.
Thanks, Max, for having me on. I'm really happy to be here. You did name some of the things I've been thinking about for years. Been in college counseling for over 10 years, like 12, 13 years of training. And so it is where I practice and who I work with. I think thinking psychodynamically has been really rich in the brief models. And what I've been really working on and thinking a lot over the years is first how to conduct brief therapy and how brief therapists have an orientation towards therapy that is very much focused on there being a time limit and focused on therapy not being a full cure, but therapy being something where you can get a chunk of work that's done that's really meaningful. That people can walk away feeling like their relationships are a bit better, or they've been able to make some change in their life that's really meaningful, or they've been able to connect with themselves on a deeper level or kind of access their feelings, access what's important to them. I think what's been interesting for me over the last few years is thinking about the ways in which brief therapists advocate for their approach and the time limited nature, having a limited focus of treatment. It's not just sort of ended. And in a lot of the ways in which brief therapists advocate for their approach is sometimes contrasted against longer term therapy. So if you're learning about psychoanalytic or psychodynamic ideas from a brief therapy perspective, you're often learning critiques of longer term ideas or sometimes traditional psychoanalytic ideas. So over the years, it's been interesting for me to toggle back and forth and hear the steel-manned arguments on both sides of some of those debates and to see how it's actually really useful to understand some of the traditional ideas and why they're there and why they're important to treatment. And then when conducting brief therapy, to be mindful of when am I going to have a stance of something like neutrality, where I'm going to really help them explore both sides of their conflicts. When am I going to pull from some of my training in ADP to help someone really feel and lean into an emotion and have an experience where they can feel and express an emotion with me and something that feels new and different and revitalizing. So I've really appreciated both of those perspectives and how to integrate them over time, as well as integrating some other techniques into a brief psychodynamic model.
So for me as a layperson, in essence, in listening to you, there's the presumption, and correct me where I'm wrong, as someone being naive and on the outside of that framing, seems to me that there'd be more, maybe making this controversial for the sake of the 15 listeners we have today, that most people choose sides. And this is something we discussed prior to recording. And one of the frustrations that motivates me and maybe motivates you, motivates me in the sense of my practice and also trying to, sort of get this podcast or movement off the ground. But also what you're saying is that amalgamating or hybridizing doesn't necessarily dilute, but actually can be more effective, or at least just as effective, when there's a goal in mind that's conducive to both short-term gain and priming, maybe would be the word, for long-term development.
I definitely agree with the choosing sides things. I have a lot of respect for Paul Wachtel and his writing when he speaks about therapy integration and how he is trained as an analyst, learned from some of the early behaviorists, and integrates both of these ideas into his work. And when he's working psychodynamically, sometimes he'll talk about it having a behavioral accent or a CBT accent. And then when he's doing CBT, he'll have a psychoanalytic accent, and how sometimes they'll do an exposure and that'll make someone realize something important about themselves and they're in an exploratory place. And so I definitely think sometimes this silo creates this kind of in-group, out-group thing where you're supposed to agree with the in-group and not learn from other concepts. So I definitely think integrating those things are so important.
You've been practicing, you said, for over 10 years.
Yeah.
And in your experience and the thousands of hours then that you've done patient work, it's never felt at odds to you to be integrative, any of these modalities. And again, correct me where I'm wrong.
Yeah, well, I think it takes work to be integrated because
Sure.
I do think, like, if you're training in CBT and you have your CBT supervisors talk about, one of mine talked about having a colleague who was a psychoanalyst or psychodynamic therapist who had a client in their practice for 20 years. And my supervisor was just like, I don't get it. Shouldn't the person be making gains? Why are they in therapy for so long? And so when you train with someone, you sometimes are training into what they approve or what they believe. And so then when you switch to train in a different modality, they have another culture. The ACT folks are actually really critical of CBT, and that's an interesting thing from a psychodynamic perspective. And so there's a way in which you have to both learn from supervisors in readings and then also learn how to kind of check some of their critiques at the door or disagree with some of their critiques. And so sometimes it is like this, okay, how do I learn from this person and also disagree? And I think it's also like you sometimes have to stand alone a little bit, because if you don't, if there's two perspectives and you believe in a third perspective that's a blend of the two or a hybrid of the two, you might look around and there might not be anyone who's like, oh, okay, I'm with you. I agree with you. You're taking the stand. So I do think it takes a certain courage, or it takes the ability to stand on your own intellectually and kind of think through what you're doing and have a rationale for it, and why maybe you're not practicing in one.
You, how did you cultivate that in yourself? Put you on the spot a little. If you felt
Yeah.
this seems to be very common in my understanding, my training, my experience at an institute, my experience at university, my experience with my own patients, what have you, or teaching and supervising as well, is that as we know, there's people who are Ians, right? The Freudian, the Kleinian, Cahutian, all of these things, and that, or they're identified with the alphabet treatments, and they say I'm staunchly CBT, DBT, EMDR, ACT, FS. And the lay people, they don't give a shit about any of this, right? And that's what's so funny. And that's again part of what we're trying to illuminate here. And so, for you, a big question for me that I would have loved to hear, thinking if I had a rewind button or a time machine from 10 years ago, is how did you tolerate and cultivate your ability to listen to yourself, knowing if you had a supervisor or a group or a culture of an institution that said, be more like this or be more like that. And you were like, well, my understanding of helping people is helping people, through the good ideas that are held within any modality,
Yeah.
especially within the, as they call, the narcissism of small differences, where you and I have discussed as well, where it's the same idea just in said in different words, and it seems to be fighting neurotically for the sake of fighting.
That's a great question. And the thing that pops in my head are actually two people.
Okay.
One professor at Stanford, I won't name him, I guess, but he was a trainee of Mnuchin, but he talked about how he was just a person who's very thoughtful. And he talked about whenever you're at a new job, write down your initial thoughts and impressions, because after time, it's gonna seem like second nature. Or he said, every 5 years, I feel like it's a really good exercise to write down like what your theoretic orientation is and how it changes. And so I think he had that spirit. And then I had a supervisor on internship and postdoc who was very psychodynamic. He trained in Colorado, but he was in Boston for a long time and had a group of fellow psychodynamic clinicians in the same consultation group for something like 25 years.
Wow.
He was, yeah, super thoughtful dude, but also integrated ACT and CBT and DBT. And so he really thought very deeply about case formulation from a psychodynamic lens, but then thought about, okay, in a brief model, maybe I'm going to formulate this person developmentally and then think about some skills I want to help them learn to deal with tolerating distress or emotion regulation or something. And so I think it's that kind of thoughtfulness. And I think when you've met people that are really take their work seriously as integrationists, some of the critiques don't feel like they land as well, or some of the camps don't really battle. My first supervisor was a CBT supervisor, and she's probably one of my smartest supervisors. Not that like getting a PhD at Yale made her inherently smart or something like that, but she's just like a very smart, thoughtful person who would have like two or three hypotheses for each person she worked with, ruling them out, ruling them in actively in her work. And so for me, it's just, yeah, if everyone were to say all CBT therapists are really shallow, like, no, my supervisor, Susan, is actually really smart and great at working with the vets. the VA. And so I think it's the different people just honoring their strengths and honoring the thoughtfulness that helped me realize like that. And I think it takes a little like chutzpah to be like, no, I also want to listen to myself and what I think is clinically, and also be open to growing and learning from people while also learning from your work. If you've worked in a certain way and you've helped people and you know that in your bones, it's hard to totally throw that away and think, okay, maybe I'm all wrong. It's like, okay, maybe there's things to learn, and maybe there's new research, maybe I can update my thoughts. And I've helped people using different modalities totally, and they've gotten better. It's college counseling. Sometimes you do a course of therapy for 8 sessions and then they come back in 2 years and you see that they're doing a lot better. How much of that is life? How much of that is growing? How much of that is your therapy? It's kind of hard to say, but
It brings me to my next question of is there a metaphor you use in describing to those of us unfamiliar, and thinking again of people listening today, of 8 hours, right? Or 12 hours, whatever you get to do is so foreign, right? To me, it's so alien given my clinical biases towards long-term work or analytic work. Although I've had patients, of course, where they've stayed in essence for only a handful of hours, 5, 10, 15, 20, 25 hours. Maybe they were primed, maybe they felt or thought or saw something, experienced, I should say. But that often in the bias of my training moves them towards something that is uncomfortable, and then there's the exit. For you, it's intrinsic to the approach is knowing this termination, as we call it, which in my anxiety, not being as familiar obviously with what you do, I would say, oh my God, I put a lot of pressure on myself, I guess if I was newer at this, and then I'd have to work through that in my supervision. But for you, there's this very earnest catalyzing of momentum of saying, well, I keep using the metaphor of priming. That's how I'm conceptualizing it. That if somebody learns something, reflective functioning, mentalizing, gives space to themselves, or permitting more than one emotion at the same time, something that can be so elemental or fundamental, and they only experience that for the first time in the context of the relationship with you for 8 hours or 10 hours, that can be, as you said, a meaningful change, to cascade through the rest of their life. I know I robbed the answer from your mouth, but it's very interesting to me. It's very valuable to me because the dogma or the orthodoxy of all these schools seems to have really harmed us in ways when it can be. Why I was excited to have you here today is to hear HEAR, in that case, what that's like, because it doesn't have to be handicapped.
yeah, I think there's a lot in your question and comments, Max. I think like
Well, I don't shut up, so I understand.
I can have that problem too. I think to the question of metaphor, I think I sometimes think of this dialectic in brief therapy, and I always feel it's a little cringe, but it's sort of miracles can happen in brief therapy, and sometimes it's just a start. And I think sometimes it can also be easy for in a brief therapy for someone to seem like they have a big breakthrough or something meaningful happens, and then later they're back to their, I'm sure in longer term work, they're continuing through
Yeah,
work.
we call it a flight into health. Are you familiar with that? Yeah, yeah.
Yeah, so I think sometimes brief therapists can, or even like session therapists can kind of do this victory lap that's a little premature. And I think sometimes people really have really profound experiences where they really feel like they're themselves for the first time. And I think part of being a brief therapist is having this tolerance for not knowing, I guess, for like negative capacity, right? Like not knowing how much is this going to be this change where you change someone's trajectory. That you may have not worked through everything. You didn't get to see some of these issues come back, but they really had this meaningful experience that now they feel more open to taking certain risks in their life or opening up to someone else in their life more and connecting and having greater intimacy, and that it carries on. So I think part of it is like being open to that dialectic where you're working with them, you're open to going there with them. And some people are really entrenched in some of their challenges. And I think sometimes it's really a start that they have some corrective experience of talking to someone who is listening to them, who's trying to understand, who maybe started to highlight how they might get in their own way or what some of their difficulties are. And they're starting to think a bit more psychologically about what they're going through and have a bit more hope that someone listening. And then another part of your comment was I think it takes a lot of tolerance for our self-esteem as a brief therapist because we want to feel effective. We want
Sure.
to feel grateful for our health. And I think that's really under discussed and underappreciated for brief therapists. I think about DBT, how they have consultation groups where because they're working with folks with borderline personality disorder, it's about support and help and in consultation, but it's this idea of this is hard work. And I think with brief therapists, if we don't acknowledge that, then I think we can get too caught up with trying to be effective and pushing people or impinging more, doing things that maybe more for our own narcissism rather than for the clients. I do feel like that's an area where I know people have talked about it, but it just in each culture I work in, it feels like something that's a little like under discussed or appreciated. Just how much humble pie we have to eat.
Right. There's yeah, there's no dearth of narcissistic injuries in this job, no matter the modality. And so you're either injured because you worked with somebody for 5 years, let's say, 2 or 3 times a week. If they're lucky, you're lucky, and then it's they're committed, and to essentially the same personality structure because it's the fabric of their being, and unlearning or relearning or resolving the interior discord or inner conflicts that generate that could take longer than a few hundred hours. Or you're with somebody for 5 hours and you're saying, oh no, I didn't help them and now I feel impotent or ineffective. When how do I manage that? I think you bring up a good point of impinging is often the straw man argument against the challenge of the frame or the pushing against the frame, where if we're foisting solution, another argument I've heard, onto the patient or projecting it into the patient or imbuing or inculcating, we're necessarily robbing them of the discovery. But short term isn't as conducive to the quote unquote ideal of free association because you only have a certain amount of hours. So there has to be, in my understanding, correct me where I'm wrong, some form of intervention. There has to be an activeness, if maybe that's pejorative to some people, but you have to be a little bit more active for the sake of time and the sake of care and the sake of concern and tact for the patient, for the client. If knowing that there's a real clock on the wall, 10 hours or 8 hours is not a long time.
Yeah, 100%. And for this meeting, I was looking through, I don't know if you're familiar with Hannah Levinson. She's been like a proponent of like time limited dynamic therapy before
Okay.
that with like Hans Strupp and Jeffrey Binder. But she has one of her books has a nice summary of like the history of brief therapy and some of these debates. Like,
Is the book short?
it's really, yeah,
I'm asking because it's brief. And anybody understand my pun? Okay, good. We got it. We got it. We'll scratch. We'll edit that out.
leave it.
I
Um,
nailed it.
nailed it. But yeah, I mean, she talks about how these debates went back to Freud and his colleagues, like
Yes.
and Rank breaking from him. And then even I recently read Peter Gade's biography of Freud, and even Freud had single session meetings or brief consultations with famous composers and things like that. We got a lot out of it. And so, yeah, I
Of terminable versus interminable. I also think from coming from a pretty Freudian institute, but the Hornian Institute, who was the founder, I still think of the booster, as it was called in my training, of the patient who successfully resolves the transference neurosis and then comes back periodically for the rest of their life to get a booster. Because
yeah,
the subject object relationship kind of deteriorates a little bit. They start conflating object and object, and they say, oh, can you remind me again of what a good environment or a good enough relationship is? Oh, I feel better. I'll see you in 9 months. I didn't mean to interrupt.
no, that's helpful. Yeah, and that happens to us with working in a college counseling setting, where someone will come back for a little bit even after they're doing better. So that's interesting to think about. Yeah, like at risk of repeating myself, I just think part of a lot of the brief therapy theorists were breaking with some. Diana Fosha, when she writes about the history, writes about each iteration breaking with a taboo that was set out in the first place. And they even and Levinson even starts with Freud breaking taboos. He's breaking this taboo of talking about sex and aggression and
Sure.
the office, and then forensic, and then there's like Lee Davenloot with ISTDP or David Mallon being more active, and even thinking about therapy can be brief and that doesn't have to go on, or being more active. And so each iteration or neutrality and expressing explicit empathy and warmth, I trace back to forensic. So there's these different things, and I think part of what I think is useful about taking a step back from the brief therapy is just to recognize that sometimes if you are learning about an approach to therapy that's critiquing traditional psychoanalytic ideas, you're not necessarily learning those traditional psychoanalytic ideas from theorists that are articulating them well. So I think sometimes there's a lot of critique of, you have to help something. Like, there can be this critique of neutrality, and then you might look around and your colleagues haven't really heard much about neutrality or understand what the intention is or what the principles are behind it. They might think it means being cold or not being warm or not helping someone or something. So it gets translated into these arguments that don't lend to creating a space for someone necessarily to be self-reflective or to explore their conflict on two sides, or even to know that like newer therapies, when they're advocating for something like IFS will say like there's all parts are welcome, right? Like another way you could say like that's different parts of the selves are welcome or conflict is welcome, right? Like there's ways in which like the wheel gets reinvented or you have fewer choice points in the moment between, okay, when is a student coming to my office that might be failing out of school who doesn't know that there's such thing as grade forgiveness at my university, or if they fail a class, they can retake it. And there might be times where I might not start with just exploring their thoughts around failing out of school. There might be times where I'm like, hey, did you happen to know about this? They know about that. And then all of a sudden, they may no longer be so suicidal if they were suicidal. That's a very like problem solving, solution focused thing. But in the college counseling setting, that might really relieve somewhat of things. And they have a positive experience with meeting with me and they want to continue therapy, then they might put their heads together and think about what they want to work on. So I think it has this flexibility with how to be helpful while also grounded in all the ideas.
Again, you bring up multiple points for us to touch on. Maybe in no particular order is how do you negotiate that in that example of when to say something like, oh, there is a great forgiveness versus leaving the space open for exploration. I guess in essence, this is obviously the answer is case by case. If
Yeah.
I were your supervisee or you were my supervisee, that would be for us to explore. But for the sake of today's conversation, it's such a valuable thing to wonder or explore through or feel through and saying, well, there's this always this tact, this art and science, this tension that's insoluble for you, where you don't want to collapse the possibility of exploration, understanding, neutrality in the robust and real sense of the concept. At the same time, solution focus isn't, again, a pejorative if it provides somebody that life preserver, life raft, whatever the metaphor, given a limited amount of time. And they say, oh shit, I didn't realize I could retake the class. I didn't think of it that way. I didn't realize that there was meaning and function being generated, that was giving rise to my suicidality, et cetera, et cetera.
Yeah, I think loosely about the supportive expressive continuum, but I'm familiar with that. Glenn Gabbard writes about it, where there's times where you're helping someone gain insight or come to terms with parts of themselves that are disavowed or feelings that are defended against on one side of the spectrum, and on the other, you're supporting them, you're shoring up ego functions, you're helping someone get by. As well as not necessarily maybe literally, but just thinking about Maslow's hierarchy of needs too. Like some of our students are unhoused or have a lot of financial issues. And so I think some students come in and they're in a place of crisis and they need stabilization. And how do they get through the day or get through the week, or do they even need to be hospitalized? And there's times where people are in a different place where they feel like they're handling their situation, but they want to understand that their suicidal, this is just one example, suicidal thoughts around failing also have to do with disappointing their parents, and how they're maybe a first generation college student. Their parents worked really hard to give them the opportunity to get to college, and they feel like they're disappointing them if they don't live up to it. And so I think there's this tune to the person sitting across from you, and not being above helping someone with their functioning if they are in a really stressful place. Also, yeah, like you said, I think it's negotiating, like it's creating room. Like sometimes someone might need the place to process their feelings around it. In coaching session, we have like same day services. And I think there's also the lens of culture. I think some people, we work with international students who come from different cultures who within their family are used to I'm thinking from like a problem solving kind of place. Yeah, and I don't always will go along with it. There's sometimes a dance between people. Sometimes someone wants to understand something or share, or talk about something on the one hand, and they might be more inclined to problem solving. So sometimes just naming these things of the different parts of themselves that wants to find the answer, that wants to understand, and then there being choice points.
I said this uh, again to the people listening today, the seven of us. Deem and I had this conversation about a week ago, and what was impressed upon me, and I was also impressed, was that the I'm going to be a bit lame, but the spinning plates metaphor. In my naive idealization of you, take the compliment and let me flatter you for a moment. It seems like you have to negotiate more spinning plates than me. I have this luxury slash responsibility. Everything is paradoxical in this work, as we know, of intense intrapsychic and interpersonal attunement, but I don't have a time impingement, or if that's the right phrase, as often. I do in terms of financial stuff, insurance not covering stuff, of course, um, but it doesn't feel as much in the room. For you, it is, and so it changes so much. As you said, you have to. I'm imagining you picking the fruit for of all these the labor of these trees, these different modalities. Is that negotiating the neutrality, like we talked about, and that these cases where you do have to be problem solving for the sake of time and protecting somebody from themselves or from an interject or from a cultural sensibility. At the same time, you want them to honor that or celebrate that. At the same time, you can't be silent, quote unquote, right? And in the exploration entirely, if there's only 5 more hours available, but you also don't want to impinge on that exploration if they are going to, given their rights to self-determination, self-preservation, et cetera, going to find it themselves, teach a man to fish type of thing. And so you have a lot more to pay attention to. And there's a lot more art and tact in my flattery of you and my understanding.
Part of me, I should just take the compliment. Part of me thinks there's skills in doing both. I think, right? Like
Sure, sure.
discipline, right? Sometimes to not just like jump in with some great idea and let a client come to their own discovery. But I think as you're saying, I think maybe part of the brief work is like sometimes just gently offering things or ideas for people to play with and to consider, where you're not, in some ways, I guess it could be seen as an impingement, but it's not an insistence. And so there's times if someone wants to get something out of therapy, we have a focus of therapy while I'm also flexible for them to be able to share and to talk. There's times where I might tie things together, and sometimes the client, let's say client California, different than you, but sometimes the client will really go with that, and other times they want to keep going, and so it's like letting it go. And so I, yeah, I think in the brief model, it's there. I'm looking for moments to tie things back to the focus, and I'm also looking sometimes to summarize things and to bring things together towards where they might continue to grow. That's aligned with where they want to grow. And so there's ways in which I didn't even know I was doing it, but someone at the end said to me once in a termination, just that I noticed towards the end of the session, you tend to give me hope, or you tend to put things together. And I don't think it's a toxic positivity. We talk about those hard things, everything's fine, but there's a line through what we talked about that we're naming where they're growing psychologically. We're naming, even in naming grief, that naming that's a process is in some ways paradoxically hopeful, because rather than just stuffing the experience or feeling shut down, there's some sense of, okay, I know what my next psychological task is to continue this process and to allow it to happen. So I think there is this way of naming the direction of treatment. Or another metaphor I think about for brief therapy for some folks is it's really an on ramp. That someone may have felt stuck or felt like they don't know what's going on in their life, and they may not, it's not like they're going for a cure, but there might be a way in which, oh, I can talk about myself and understand myself better. I can feel more alive through recognizing that I feel angry, and it's okay to express my anger, or to be able to have a frank conversation with me and realize I can have frank conversations with other people. So I think there's a way that it's naming what's checking in about what's been helpful, what's going well, and in this direction. They can continue to work on this, aligning with themselves, growing, healing.
The on ramp is helpful. I was saying priming, the same thing of you're providing permission, right? Almost you're playing the good object, the good enough mother, father, caregiver. And think of the difference in so much of analytic theory the difference between the map and the territory, and so much of that being conflated purposefully. It's seductive in the context of today's world of media, social media, et cetera, where expertise is, on trial right now. And part of that's for a good reason, part of that's for some pretty neurotic and defensive reasons. But in the case of your type of work, as far as I understand, if you're drawing the map with them, then they take that with them after the 8 or 10 hours, which is a different orientation and not necessarily, like you said, impingement at all, but is, in my opinion, priming or helping them understand. If you had the luxury, maybe you would take that map with them and start hand in hand, right? Not to be ahead of the patient or vice versa, or the client, and enter into the territory. And sometimes you might have that opportunity in 8, 10, 12 hours, and sometimes you don't. And so you also have to be considerate, mindful, on top of things, and um, deciding where the energy is going to go, feeling in the spontaneity or improvisation of the room, even into that very moment. And 10 minutes into session might feel you're building the map, and then 50 minutes you might be dipping one foot into the territory.
Yeah, that's a really great metaphor, and
Yeah, I'm really good at this, so thank you.
you're really good at this, man. You should try therapy. Come up with some things in the moment. Yeah, I think that's really I think that's the idea with brief therapy. One done well, it's like you're helping someone to go afterwards to take it with them. And a lot of people want to continue therapy. I think I don't know. I don't have like an agenda with people around. Okay, this is just a start. You have to continue after. But I think for some people, I think Ed on Twitter, I think it was last name. He has this idea: brief therapies. Some people just want to go farther, and then in longer term work at parent. Some people
Sure.
keep continuing and they want to go further than they could go in brief therapy. And I think that's really true too. So that's often feels like a good outcome too, that someone got something meaningful, they're doing better. We drew the map together and they started to go somewhere on the GPS. It got somewhere a bit. There's some benefit and they want to kind of keep going and keep working.
Is there anything that you feel isn't, you said a little bit before, but is there anything that isn't obvious insofar as the motivation to this work? Although I'm figuring it out myself a little bit, fighting the fight for meaningful therapies, celebrating or valorizing or proliferating the things that are falling beneath the cracks in training and treatment for the patient, the client, and the practitioner. Is there
Yeah.
something in particular that's like really close to your heart that you feel really impassioned about, that you want to say relevant to anything we're talking about today?
Yeah, I love that question, Max. I think that's something that's on my mind a lot. I think there's a big push for college counselors to do more with less amount of time, less amount of resources. There's sometimes some troubles. Not speaking for my university, but I do think there's something.
He is not speaking for his university.
Yeah, thanks. So
I'll put a an alarm on there too.
yeah, I think if you're in college counseling, every 2 to 5 years, you probably get trained again in single session therapy, and there's usually not that much that's new to the trainings. It's this idea you have that I think they say the modal number of sessions people come to therapy is one, so you might as well make the most of it. And
Is
there's
that true? I'm sorry. Is that true?
I have to look more into it. I think
Okay.
probably pulled from somewhere, but I don't know where that data is pulled from.
Yeah.
And I mean, I think most trainees, if their clients left after one session all the time, they'd probably be in remediation. Or if you're faculty and your clients left after one session, you might lose your job. So part of me is like, how much are we taking this?
Yeah.
Their idea is to make the most of it, but then yeah, that goes back to what you were saying before. What does that mean? Did that just mean kind of impinging? And so I do think that like administrators aren't always on the front lines doing clinical work. Sometimes administrators aren't therapists, and so they're looking towards who do we listen to how to make a center work. And I think this is not just my center; I think it's across the country. And so I do think people can miss out on the power of therapy to like really find yourself, to really feel different in the world. And my sense is that it's like the military industrial complex. There's this iron triangle of different people who have different interests, whether it's at the government, the military, congressmen and women and persons. And so there's this way in which they all have these interests that feed into each other. And I think there's something similar between healthcare companies that don't want to pay a lot, mental health tech that wants to make money, wants to promote things that are super effective, administrators in different departments who want to feel like they're paying less. And also, I think it can feed on for the public, like this idea that, oh, maybe this one shot thing's going to help me feel all better, whether it's an app or whether it's ketamine or not to say it's not helpful, but there's this kind of idea of like let's do things really efficient, like bigger, better, faster, stronger. Jonathan Shedler talks about like therapy is about slowing down. It's about creating spaces where there weren't spaces before. And so I do think there's this way in which how do you acknowledge that? Yes, in college counseling center, there's times where we do meet for one session. Some people even talk about brief therapy being some people who exit longer term therapies being brief therapy by default. Like if you were working with someone, you were planning to work for a long term, they stopped after 8 sessions, they kind of had a course of brief therapy by default. So I think these things are good to think about, but it seems like sometimes there's not an argument on both sides. Like if you go to a single session training, they'll show you different slides about all the effects of treatment happen in the first few sessions, so we might as well not have many more. And sometimes I don't know if it's like an academic clinician split, but I do think there's something about clinicians standing up for being clinicians and standing behind their work and feeling confident to be able to speak out that they're effective. I think the problem is how do you do that without sounding kind of like douchey or like an elitist or, because even though I make those arguments, it's not like all my, when I have certain cases that go really well, certain cases I struggle with, certain cases that there's also this humility. So I think maybe that's also part of the analytic attitude or psychoanalytic
Sure.
culture where we don't have all the answers and we're helping someone come to their own and understand themselves. So maybe there's this dialectic of how do you both make the arguments and paint a picture about how longer term work or depth work or just how therapy is really meaningful when a lot of people are trying for different reasons trying to find the best.
This is also a little bit embarrassed because it's so cliche, but it seems to be universal as my time steeping in this, whatever this is, these interviews, these conversations. It seems, I think you put it well, the force behind the clinician, be that intrapsychic within the clinician themselves, or the union of all clinicians internationally, but the boots on the ground people. We tend to be the quiet ones. I think the military industrial complex is an apt metaphor of, or the triangle for us, right? As health insurance companies, universities, or university administrations, and maybe the public themselves, or Silicon Valley. Maybe it's more of a square,
Right.
a
Yeah.
quadrilateral for us geometry geeks out there. Also, douchey, it will be in the DSM-6. Is that correct? Douchey personality disorder.
Yeah. I think inadequate was in DSM-2, right?
Okay, so yeah, well, douchebagitis. It's actually an endemic to our times. It's a horrible affliction to most men. I suffered from it through college, but I've been in 10 years of analysis now, so it's cool. So it is interesting, all jokes aside, that it's like you said, my default to say to you is I also don't have the answers. At the same time, I still agree with you, which is how do we, besides having these conversations or trying to attend to trainings or doing our own trainings or affecting universities or colleagues or trainees or supervising or teaching, or also, of course, patients and clients, what else can we do? But it's that, it's really the small man versus David and Goliath when you're fighting against a multi-billion-dollar or multi-trillion-dollar thing like the government. And there's this huge incentive they have because our default conscious experience, our default disposition or predisposition is to seek a solution that is the lowest common denominator, that is the quickest fix, that costs the least amount of effort. And that's nobody's fault. That's absolutely nobody's fault. In my understanding, that's the human experience or the human condition, is that we're uncomfortable with ambiguity. We're uncomfortable with uncertainty. We're uncomfortable with unlearning or relearning. I always I default back to a lot of my postdoc work, interest, extracurricular research has always been in the neuropsychoanalysis stuff, which is the fancy way to say the brain and mind together. And when you read about how a toddler learns to walk, to speak just in plain English, they really have to consciously and willfully put one foot in front of the other, especially if you've ever witnessed it. And then I think of you work with some form of an adult, a latency stage child, an adolescent, young adult, middle-aged, elderly, and they have to unlearn the way they've learned to walk for the last 50 years and then relearn it in a more authentic and effective way that's inclusive of who they actually are, their own potential, and their ability to strive towards meaning in their lives. And they look at you like, what the fuck are you talking about? That's not possible. Or how do I do that? It's been hardwired, kind of a lame metaphor in
Yeah.
neuroscience. And so I really sympathize that this conversation comes up all the time of how do you not feel jaded, or how do you feel effective, or how do we as clinicians help out as best, as effectively as possible, as generally as possible when we're fighting against, some real tides that have swept away most things. There's plenty of people we know, just to put a button on it, that have said the ship has sailed, that we lost the battle.
Yeah, that metaphor sometimes is true. But as you're talking, I just keep on thinking about limitation. I had a supervisor who's a DBT therapist, and I asked her what their theoretic orientation was once or something, and came up and she said something like, well, it's DBT now, but in 5 years, if there's any new approaches that are more effective, I'll switch to that. And there's this idea where therapy is going to always get better. And so that's one of the things I struggle with. On the one hand, wanting to be open to new ideas, new theorists, and we're seeing AI. Who knows what implants in our brain in 10 years or something? But yeah, in what ways can therapy get better? And then in what ways are we just bumping up against human nature? And therapy is just going to take a while. And part of it is not always about improving, but just doing the craft as thoughtfully and as meaningful as we can. And I wonder about that a lot. The metaphor of therapy, is it like a linear thing where it's supposed to always improve or get better? Or I sometimes think about basketball. There's different generation of basketball stars, Larry Bird, Magic, Michael Jordan, and then there's, Kobe, and there's LeBron, and SGA, and you have Curry. At some level, if you I was cracking open an old Melanie Klein book, and she was talking about a client just getting relief from an interpretation. Oh, I don't know the whole course of that therapy, but I know that she probably was being honest that she did something with a patient and the patient felt better working with her all the way back then. Right. And so I do wonder, always wanting to improve, if we don't just accept that certain things might take time, and that might actually help patients and therapists both settle into doing the work rather than wondering like what they're doing wrong. I don't know. I feel like there's a dialectic. On the one hand, I'm open to new theories. In the basketball metaphor, like the Golden State Warriors changed how the game's played, right? There's more
Right.
players. Right. So it's not like there's not interdebating.
Right. We get it. We get that you like. We know what Curry did. We know. We know. We know.
Well, almost something.
Oh, okay. Yeah, it's a good point. I think it comes back to the permission again. You're permitting yourself as a practitioner, as a clinician, you're permitting the patient, the client, to explore, to understand, to relate all the things we're paying attention to or paying affection to. And it doesn't necessarily need to be improved. It's a really good question. Obviously, the first thing to say is I don't know, but it's also to say that what you quoted before from Shedler, of the fastest way through any of this is to slow the fuck down. And it's not about optimization. It's never going to be. It's not going to be about synthesis in efficiency. This is the same thing as the Moore's law, shrinking transistors and getting more power, more efficacy, or more strength out of fewer electrons. This is the human condition. And so I think, like you said, there's always going to be a threshold or a limit into what's conscious versus what's unconscious. There's always going to be a limit into how fast somebody could change, either on the most fundamental personality structure, psychological anatomy level, versus coping or symptom management or reflective functioning or something very acute and focused. And none of these things are mutually exclusive, as we've been talking about forever. But it is disconcerting, right, at times, to see you attend a conference, as we all have, or you attend a training, and they bring up another slide deck, and it's another. How many slide decks have you and I seen? Just the two of us. Think of it, our whole careers, that say this is the new form of therapy, or this is the most effective thing. And here's the slide deck and the data that proves it, the data that prove it. And it's like, I don't know anything about your study. I don't know what you're actually measuring. I don't know what confounding variables are there. I don't know what iatrogenic variables are messing the waters. I don't know anything about your study versus the control being no therapy at all, as a classic example.
Yeah.
And so I don't know either. My thing in asking you is about, I guess, in essence, what precludes or obviates the need for burnout, at the same time provides you the meaning of the work you're doing. And so you answered that already, but it's very powerful that if we stay agnostic, we're open to understanding, but we can't be so agnostic or so tolerant of the nebula that our brain falls out of our head. And just like you said, there's always going to be this dialect.
Yeah, as you're talking, I was just thinking about there's respect for the person that someone suffered from something for a long time, and the experience of knowing that you can often both help someone really well, and this idea that there's that we could get in the way by trying to find some quick fix rather than learning to do the work and respecting that something is a process. So it's not. I mean, I think sometimes it's this question too, or like some of the CBT people. I don't know. This is sharing more not in that culture, but sometimes there's this like, oh, we're the ones that do ethical, empirically supported treatment. You're the ones
Right.
that are not, as if like not interested in science. You don't care about science or research. Since I was in some of those circles in grad school, I knew there's a lot more randomized clinical trials for psychodynamic work. So the terrain's changed. But I think there's something about, I just know that if you have a formulation about someone that you understand that their problems have generated a while ago, that they have these roots, then simple things like asking someone to go on a walk or to do something light, you're going up against more than that. So I think doing that, doing the work and honoring the process will help you and help the person get there faster by not trying to do some kind of magic bullet thing that's gonna overpromise something or make something someone disappointed that it doesn't help because the work's gonna take a bit longer. And I think to your question around burnout, I think part of it is getting support sometimes for the work, like I was saying earlier, and also expectations, just to know that some people are going to be really helped in brief treatment, and to know for some people you're going to help them have a start, and to not expect that each person's going to have a certain outcome or certain, even though my whole job in each minute that I'm a therapist is trying to help someone the best that I can, even if it's really just listening, or even if it's really creating space for them, or even if it's listening and also thinking in the background about how I might say, or what I might reflect back, or what I might notice in a few minutes. And so I'm both really trying to help someone as much as I can while also affecting the process in their psychology.
It's an interesting place for us to end up on, where there is that anxiety of not just AI, which I have plans with upcoming colleagues of ours to speak to, which is exciting and also scary. It's also, like you said, the respect for the process, that you trust the process, right? It is what confers the possibility of change. There is no optimization, there's no speeding up. And it does seem, though, that that will always be there. And speaking to expectations, I do feel more tolerant, which is to say confident, or at least clinically confident or competent, because that is very human. I want the answer. I want it now. I want the quick fix. There's nothing that's, I hate, strong word, but I feel frustrated when that's moralized as if that's bad, even though we all want that as human beings. And again, metaphor, but we're wired that way based on all sorts of efficiencies and gains. There's a reason why ice cream tastes better than steamed broccoli, and it's not rocket science, so to speak. It's the sugars and fats and proteins in the ice cream that confer a lot of caloric or benefits or energy. And so that's the same principles when I know I always cite or substantiate my convictions on this stuff with the neurophysiology, but it's because it's true that a lot of that stuff is the fundamental, skeleton or framing of, in my training and understanding of what gives rise to so much about our own psychological idiosyncrasies or proclivities or conscious or perceptive biases. And so I cannot blame anybody ever, be it the clinician who's now selling the reinventing the wheel for the 547th time with this new acronym type therapy, or the patient or client who says, I just want to get better now, doc, fix me, fix me. I don't want to do the heavy lifting. I don't want to feel the things that I've defended. I don't want to open up the filtration system, turn the valves open, and start to have to experience and feel things that have become rote and defended and inoculated from affect or immunized from affect. And I get it. I'm a patient too, proudly and neurotically. So to bring it, back, the short term work has its, to me, sort of, it's in the idealization. It's this extra strength and pressure, at the same time demands and art to accomplish it. And then there's this other layer, like you're saying, more globally, of this. We've listed a trapezoid or a square of all these external pressures, and now I think another one, making it a pentagon. No military pun intended. Is that it's human nature, right, to want a fix and say, Nadim, I've been here for 6 sessions and I don't feel any better. What can you tell me what to do? And that's something that we're always going to fight against. And that's something that, for example, Silicon Valley is always going to have up their sleeve, being like, well, if a billion people want the quick fix and I can make it look like through my marketing and my AI and whatever else, how do you fight against that?
Yeah, and I think that's what when you talked about confidence, I think that comes from experience too, of knowing
Sure.
working with people and not giving up and staying with them, and then having examples of what someone did turn a corner at a certain point, or something shifted, or someone got something, or something it clicked for someone after a while. Um, know that yeah, hanging with it, and I think the trust in the process and that confidence comes with more experience, and also more willingness to admit that we don't have this omnipotence, that we don't have this omniscience, because I think that's the humble pie that gets built into oneself with more work, and then to own that. And I don't know. I think for some earlier career clinicians, that can be a huge relief for someone who's really experienced to talk about a case not going well, or they really made a mistake and the case went south. I think there sometimes can be some anxiety because they might be able to go and pick up a book of someone who says that they solve everything in such a short
Right.
period of time, right? So sometimes there's this idealization, devalue thing. Oh, so I guess you're not the person I should listen to. But I think if someone has a certain maturity, there's something where we know some people are wise. They're really brilliant in how they talk about people, how they understand people, and personality are different things. And even the greatest clinicians like have cases that don't.
Of course, because like you said, not everybody's a match. I mean,
Yeah,
that's just talk about it, the eating crow, the humble pie, I mean, the face full of, I mean, you're swimming in humble pie. You've gained thousands of pounds after eating so much humble pie. You need the quick fix, the GLP-1 drug. We all have to take our, Zepbound.
yeah,
And it's really uncanny how powerful that is. We really do want that, and yet the reality is, I always think again of the metaphors from the mentors that you and I have or look up to, of the relationship is forged in the relationship. The relationship to ourselves is forged in the relationship of your primary caregivers. And so if your self-concept is this alloy is amalgamated in the hot fires of whatever parents you have that you didn't choose, to undo that, to redo that, to make the space for your own reflective functioning upon your own self or self-concept or idealized image or despised image or ego ideal, whatever theory, it doesn't matter. That takes time. You've lived a lifetime. Even if you're working with somebody who's in college, it's still a lifetime. And so you're fighting against the nature of our own consolidation, and for the sake of efficiency, our own, workspace, as it's called, of consciousness. And to have to exploit that is really fucking hard. And so it always frustrates me because it can't be done quick. It just can't be done. The only thing that can be helped quickly, my understanding is, again, building that relationship, the context of or providing context to reflect upon symptoms, steering somebody, like we talked about, is building the map, building the on ramp. There's all these things that are amenable or available to, we can quote unquote call quick. But that's not what somebody says when they say quick fix. That's not what somebody means, I should say. And that's very hard, because if you said that to a new client of yours, a new college student, that we're only going to get to here, or this is the map and this is what it's going to look like, you'd be robbing them of the exploration, even if that exploration,
yeah,
excuse me, only reaches 10 or 15 feet into the territory. And it boggles my mind how biased clinicians can be when they're the ones who are supposed to quote unquote know better, that it's their agnosticism, their humility, their tolerance for uncertainty that gives rise to the healing in the relationship, or the opportunity for healing with the patient or the client. It's almost asinine. That's why the AI, sorry, in my opinion, but the AI can't do it, because they can't negotiate all those things. They can't feel what it's like to be forged by imperfect creatures in the thousands of generations that came before us. And so it really nags at me, because
yeah.
humility means maybe for our next episode, humility means so much more than people think it means. It's not a virtue, or the virtue of humility is not the same thing as the dynamic of humility in terms of what it provides a clinician.
I feel like there's a lot in what you just said that I'm curious about. Yeah, I think if I like toggle back between what you're saying and everything you're saying is like what I would hope people who haven't done longer term work or aren't familiar with like contemporary psychoanalysis could appreciate, that there is this longer term arc that can be really transformative for people. And sometimes if I like stick up for the brief therapy a little bit, or certain for certain students, it's someone might want to like learn how to give a presentation and feel a little bit less anxious about it. And
Sure.
you might teach them some CBT skills or think about some exposures that they do where they might feel better and it might go better and they might feel like I went to therapy, it was helpful and I got what I wanted out of it. And they don't get into this neurological thing. I think the point that you made that I appreciate is the therapist that helps someone in that way to know that yes, you did help them. They got what they wanted out of treatment, but to know that there's more to therapy than that. Like that. That's where I almost wonder if like we need like a United Nations for therapy to come.
Yeah, I mean, that's what you started with. That's I said a union before. I was thinking the same thing, but I'm going to vote for you because I don't want to be president.
Yeah, and then I'm like, when I think you kind of like, oh, you could also. There's so many critiques of the UN, right? The
Right.
Security Council that has all the power over the General
Well,
Assembly.
I do have to thank you for coming today. It means a lot to me. A third guest on a fledgling podcast. You're risking a lot. I really do appreciate you coming. So thank you. Sincerely, Nadeem. I
Yeah,
appreciate it.
you're welcome, Max. I really appreciate it. I thought I was going to be on with Mark Maron, but this was fun.
Yeah, I know. He stole the name and he was like the first podcast. He's the guy. I have to, if one day this is famous, I'll call and thank him for the,
Come on, you like.
yeah, he'd be one of, and he's been in significant therapy. He's learned a lot. It was a pleasure.
Thanks so much, Max.
Yeah, of course.